Now I want to talk to you about choosing the right treatment center for your loved one. What we're really talking about here is choosing the right level of support. They have a medical problem, they have an illness, and we want to get them the right kind of help so that they have the best chance for success. The initial choice is between inpatient and outpatient treatment. I tend to like inpatient treatment much better because typically by the time a family is making a decision to do an intervention, it's no longer a small problem that they're intervening on. It's really a pretty big problem, and so you want a little bit more intensive treatment. Some of the benefits of going to an inpatient treatment center are, number one, that we're going to be able to guarantee that the person's going to stay clean and sober for the period of time that they're in treatment, probably at least a month. So that's a very good thing. They'll also be working on the problem 12 hours a day or more. Typically, the treatment day starts around 7:30 in the morning and doesn't end until about 9:30 at night. You need a lot higher motivation if you're going into an outpatient program. Because you're only going for an hour or two or three at a time, and then you're returning back to your environment, and it can really be very difficult. You really can't guarantee the sobriety of the person during that time period, and they can be subjected to a lot of different triggers. There's also a very high dropout rate with outpatient. Having said that, we sometimes, because of family resources or what insurance will pay for, we have to use some kind of outpatient treatment. And that's okay if we get creative. For example, we may have the family pay for the person to go into a halfway house, a guaranteed sober environment that's going to be very inexpensive, but doesn't really offer clinical services. But to that, we're going to add the intensive outpatient treatment that perhaps the insurance or some county funding will pay for. So by using that kind of a creative solution, we can really make things work. Now, it's important for you to call and ask the various treatment providers just how they can put these things together, and we'll give you some tips on that in the downloaded materials that we're going to give you. Another decision point for families in choosing treatment, especially inpatient treatment, is whether they want to go to a local treatment center that's perhaps close to home, or do they want to go someplace that's further away, perhaps out of state, to a top-tier treatment center. There are pros and cons to each. With the local treatment center, family can visit more easily, they can participate in the family program more easily, but it's also a little bit easier for the person to walk out of treatment if they're having a very tough day and they're just not wanting to deal with it anymore. When a treatment center is at a great distance or at least out of the state, it's harder for the person to walk away, although by the same token it may be a little bit difficult for people to attend the family program. Usually what I say is that I like to work with families, take a look at the resources, take a look at the insurance, and get the very best possible treatment that you can for your loved one. Another thing to consider is family resources. Many families don't have the insurance or the financial wherewithal to pay for expensive alcohol and drug treatment. But never fear, there are very good quality options that are low cost that you can access, and some are no cost. Part of these are covered in the downloaded materials that we've provided for you. But let me tell you, there are some very good treatment centers that cost less than $4,000 for a whole month of treatment that you can find that probably aren't too very far from where you live. In addition to that, there are county funding sources that are available. The various states have funded treatment for people who really can't afford treatment, and you have to be ready to sit down with a pad of paper and a pen and make a lot of phone calls. Start by calling your county or city offices and ask how you get funding for treatment. It may take you a number of phone calls just to get to the right person who will be able to answer your questions. But be patient, be persistent, and most of all, keep a positive attitude and be, reasonable and courteous in talking to the people, and you'll find someone who's going to be able to help you get to those resources and jump through the hoops necessary to get that good treatment. Oftentimes, getting county-funded or state-funded treatment requires a phone call from the addicted person to the agency that's doing the funding. Well, needless to say, that can't happen before the intervention, but it can be something that happens right after the intervention. So we bring the person to a good, solid yes, and then tell him or her that they've got to make a phone call here or phone call there in order to trigger the right funding. It doesn't take that much. In addition to this, there are agencies like the Salvation Army who have treatment centers all across the United States. These are good quality treatment centers. They're very basic, but they're very good, and you can access them for very little money or perhaps no money at all, depending on your own financial situation. So take the time to work through this. You may find that there are a lot more options than you think. Now, if none of these methods work for you, you can't access a good low-cost treatment center, you can't qualify for any kind of county funding, you can't find a good Salvation Army type treatment center near you, never fear, there is still a solution. You can still do your intervention using the normal format and follow all the way through, but the goal will be slightly different. Instead of going into a treatment center, we will ask our alcoholic or addict to make a commitment to go to Alcoholics Anonymous or Narcotics Anonymous starting immediately. We will ask them to go to 90 meetings in 90 days. We'll ask them to get a sponsor, and we will ask them to work the program 100%. In this case, it's really great if you can find a member of the recovering community, a member of AA or NA in the local community who can also be a part of the intervention and take the person to their first meeting or two. This will really accelerate the process, and it will be more likely for them to follow through and get into a good lifelong program of recovery. Another thing we need to talk about is detoxification for your alcoholic or addict. Now, a lot of people confuse detox with treatment. I've had many families say to me, oh, he's been to treatment 3 times. Of course, he only stayed a day or two, and they're talking about the fact that he went to a hospital or a little detox center, went through the detoxification process, and then got back out again. Detox is not treatment. Detox is simply the physical withdrawal that a person has to go through in order to be ready to go through treatment. So the first thing we have to determine is, does the patient require detox? There are drugs that require detox, there are drugs that do not. Drugs that require detox are things like alcohol, heroin, different kinds of opiates like prescription painkillers, or different kinds of sedatives, benzodiazepines like Valium or Xanax or something like that. These are the kinds of drugs, these are the classes of drugs that may require a medical detox. There are other drugs that actually don't require detox, like marijuana, and interestingly, even crack or cocaine don't really require detox. However, as we all know, the psychological part of coming off a drug can be just as powerful, if not more powerful, than the physical. So while they may not require physical detox after stopping smoking marijuana, for example, they may still need a period of stabilization in an inpatient treatment center in order for the treatment process to really take hold and for them to really get better. Yet another issue comes up when a person is taking methadone. Many people begin taking methadone because they had a chronic pain problem or because they were doing heroin or another opiate and switched to methadone, maybe in all likelihood getting the drug from a methadone maintenance clinic. Many people find themselves taking very high dosages, and for most treatment centers, you cannot go in to a quality inpatient center if you are doing more than 60 milligrams of methadone per day. In that case, the person will have to titrate down on the methadone through the methadone maintenance clinic until they are at that level, and then they'll be able to go inpatient. There are exceptions to this. There are a few treatment centers that are a little bit more medically based, and they can handle the higher dosages of methadone right off the bat. But again, this is a question that you're going to have to ask each particular treatment center as you vet them in your process of selection. So when it comes to looking at detox, make sure that you've got all the bases covered and you ask the right questions that come about from your downloaded questionnaire for treatment centers that we've already supplied to you. We've mentioned before the treatment center questionnaire that's part of your download packet, and this will help you to be a real expert in talking to the treatment centers. There are some very specific questions that you're going to want to ask them, and this is a way to stay organized and get the right answers from every treatment center that you're going to be calling. So first of all, you want to know about length of stay. What is their average length of stay, not just their maximum length of stay? What are the financial considerations? Do they take your kind of insurance? Is there county funding available? Is there a payment plan or some kind of patient aid that you can access? You want to ask all these questions and enter them into your information organizer, the record information organizer. You may also want to ask them about their various specialties. Can they handle dual diagnosis? Can they handle pain management? Or whatever the special needs are for your alcoholic or addict. Next, I'm going to talk to you about how to write your intervention letters. There's a very specific form and format that we're going to use.